and guidelines of the particular project. Now, what are some of the specific things you may want to look at in monitoring and evaluation? One is to assess the degree to which your program activities are equitably reaching both male and female and are on track in achieving program targets. That's very important. Many times we use our participant registration forms for accounting purposes, but we should also use it to actually analyze it and see whether you are reaching different subsets of the population, how many men, how many female, what are the ages that you are reaching as you keep going. Periodically track gender-related assumptions you identified in your log frame to ensure that the project logic is intact, and any anticipated barriers, experiences, or impact that might negatively affect the outcomes are identified. So at the beginning of the programs, now programs have the theory of change, their logical framework, and their theories of change. We've outlined different assumptions that a project is making. So as you implement, you look back at the assumptions that you made, that you identified in your log frame, as you're monitoring to see how the impact of the intervention is turning out, and if there are negative areas that you actually need to address. Capture the outcome of program activities for men, women, boys, and girls, which requires adequate sample size. I'll speak about the qualitatives in my next slide. Understand if programs have helped promote gender equality, or the programs have created gender disparities and inequalities, or increased existing inequalities. There's an example of this for programs in Northern Kenya that just one particular one went and then began empowering women, giving them funds to form groups and giving them money. Instead of that empowering women like it was intended, and indeed it did that, you can do that but have an unexpected outcome. The men now began feeling threatened by the empowered women, and that led to gender-based intimate partner violence in the houses. So we must be able to look at that. Are the interventions that we are doing creating new problems, or as we are addressing one problem, we are giving birth to another problem? So we should also be able to track gender-based violence and protection risk to ensure program activities are not causing increases in gender violence. Still on gender sensitive monitoring, there is lots of need. At Masico, we pay lots of detail to this in collecting sex and age disaggregated data so that we know if we are reaching all facets of the population. If we say we are reaching women of reproductive age, and that is age 15 to 49, what proof do you have that you are reaching from 15 to 49, or your interventions are saturated along 20 to 30, yet you report that you're reaching women of reproductive age that goes out? You could be missing a certain area that through your monitoring efforts, you can be able to discover. JC related indicators, where is relevant, you should have very specific one along the 5 domains that I've indicated, and Lonna will touch on them again. Monitoring of risks of unintended consequences. Our programs must really be cautious. We have many unintended consequences coming out of our interventions, but sometimes we are just geared towards our programming only and reporting our data, and we need to be aware of that. Then just into adaptive management, very key, that as we implement, we are learning and we are adapting to new things that are coming up. Complementing this with qualitatives, I'd mentioned that some of the outcomes for JC, gender equality and social inclusion, are qualitative, and periodically then we need to assess the perceptions, the beliefs, the attitudes, and how those ones have changed over time. Those ones are only done by qualitatives, FGD sessions, IDI sessions, and KIIs that can be done either yearly or after 2 years. My 5th step is on knowledge sharing on gender mainstreaming. Knowledge sharing is a process that brings us to capturing and organizing knowledge and experience, and then proceed to make this accessible to a wider audience. Now, many programs, again, many of you who've been implementing for some time will agree, we make the same mistakes that previous programs have made. We design and implement in the same way previous programs implemented, meaning we are not sharing, we are not documenting and sharing good practices, lesson learned. What do we need to drop in our intervention? What do we need to adopt? Somebody's mic needs to be mute. So good practices and lessons learned are valuable sources of knowledge, as they can enable us to learn from experiences, adopt new practices, and apply them in our next step of work.
Francis, you just kindly have 5 minutes to wrap up.
That's okay. I'm almost in the last point. Relevant gender expertise. We need to have expertise in order to systematically implement the various elements of our strategy. You can have a consultant, you can employ staffs, but somebody who is able to understand how do you do the linkages within the different areas of your strategy to the wider program that you're implementing. And that is very critical in ensuring we are gender sensitive. Finally, then, adequate resources. For us to achieve what we are talking about, for us to move from just writing it on paper and not documenting it, then we need sufficient resources. These resources should be plowed in from the time we are conceiving the concept of the project, so that we write it and it's clear and it's budgeted for. We will do a gender analysis. We will do a strategy development workshop. We'll do a synthesis of the findings to the different thematic areas. As we do our strategic commitments, we look at human resource and all that will go into ensuring that our programs are indeed gender sensitive. Gender is very critical in creating an enabling environment. And therefore, as we implement, we must look at laws and policies, institutions in our different counties, different countries. Are the policies gender neutral, gender practical rather than strategic, addressing needs of the people? Do we have effective linkage between national and county, and sectoral linkages between, because we have so much duplication of efforts? Look at power and decision making, how women decision making room affects them. Power dynamic affects household dynamics, and the household dynamics affect program outcome. Social cultural context, allocation of resources, control of resources. Do women have access? Then roles and responsibilities. Finally, this is my final slide. We are coming from our goal is gender equality. The way to get us there, our strategy is through gender mainstreaming. The 7 steps have taken us through, and integration of gender perspective and gender balance into all that we are doing. Thank you so much, and Joy, back to you.
Thank you very much, Francis, for your presentation. And from what you've shared with us, I've learned about the various ways that we can define gender and also the various concepts. The second is the difference between equality and equity, and not just having these on paper as program specialists, but moving to actually implement it or mainstream it. And then you even showed us some of the steps we can take to mainstream gender in our programs. And then you ended with that enabling framework. Thank you very much for sharing that with us. I see a couple of questions in the chat. I assure you that we will answer many of the questions in our Q&A session, and keep them coming. We have somebody that is collecting them, and we'll direct them to our speakers towards the end of the presentation. I also will just emphasize and recognize all of us that are logged in from the various countries and various counties. At a point, we had people from Kisumu, we had people from Mombasa, from West Pokot, Kajiado. Thank you very much for logging in. And do remember to rename. I see a couple of people with names that are repeated. So I'll just emphasize that click on your profile name and you will have a pop-up message which will lead you to rename. So kindly ensure that you've logged in with your correct name. I will also introduce our next speaker. Okay. Kindly give me a minute. Our next speaker is Lonna. I'm just having a bit of a challenge sharing my screen, but here we are. Our next speaker is Lonna Wanyama. Lonna holds a master's degree in development studies. She specializes on population, poverty, and development from the Institutional Institute of Social Studies, and she has over 15 years of experience in gender programming in the East and Southern African region. She is currently the Regional Gender Advisor, Africa in Mexico, and has also held other gender specialist positions in other organizations. These include the Catholic Relief Services, Plan International, and the Norwegian Church Aid, amongst others. Welcome, Lonna, to lead us in the next session of this webinar. Over to you.
Okay. Yeah, good afternoon, everyone. Happy to be part of this session and happy to be part of the K4R COP meeting. And thank you so much, Joy, for having us in this time round, and just to share more on issues related to gender and resilience. And of course, I want to thank Francis, who's gone ahead of me to share more on the basics on matters of gender and more generally on what we do when we are integrating gender in programming. So I'm going to be taking the next session and more focusing on gender and resilience. So I'd kindly ask you, Joy, if you could just begin sharing. Joy?
Give me a second. I'm having a bit of a challenge.
Okay. All right, as Joy just gets us the presentation, I think it's important for us to realize how important it is to consider issues on gender, especially when we are doing resilience programming, and going back to what Francis has just shared. So it's an important consideration, and I'm happy that the resilience group here thought about it. So to continue on with my presentation, I just want to take this opportunity to just define resilience. And I know most of us have been working around issues of resilience for a long time, and you have definitions as per your own organizations, but I would want us to use the definition that Mercy Corps uses, which looks at resilience as the capacity of communities in complex socio-ecological systems to learn, cope, adapt, and transform in the face of shocks and stresses. So I'm sure we have a wide experience on matters of resilience, and we are just looking to see how communities are able to cope, adapt, and some other organizations looking at issues of transformation, on issues on how they're able even to go back to their livelihoods on what they were doing there before. So that is what we'll be looking at. And maybe the question some of us could be having is, why are we trying to understand issues of gender, equity, social inclusion, and resilience? And I just want us to keep on reflecting back to what Francis has just presented a while ago, because I'm taking on a few of those issues. Just as he had said, we are moving on not only to focusing on issues of gender, but we want to focus on other exclusion factors, because we have realized that it's not only gender that is an exclusion factor in the communities that we are working in. There are other exclusion factors, and it is important to consider that if we are going to work with our communities. So one of the things I will be looking at is that when you look at gender, equity, and social inclusion, it has a way that it impacts resilience at multiple levels of society, and not just at the individual level. So you will see it impacts resilience at multiple levels. Then the other thing, you see the intersection between gender and resilience is that resilience also varies between and within society levels. You will find that where there is a resilient community, you may find a vulnerable household in that community. And on the other side, in a resilient community, you might find a resilient community that is existing within a vulnerable region. So you see the two somehow intersect at different levels, and they are intertwined within the communities that we are working in. Then the other thing is that just like resilience, you find that gender and society norms, they exist at different levels. They exist at individual, household, community, and also at the system level, meaning that they often influence or impact resilience building at each level. So you see the connection between resilience and gender and society norms. So the other thing is that when you are looking at issues of gender, we have to understand that gender and identity can be determinants of both vulnerability and can also increase capacity to support resilience within larger systems in households and also in communities. So in the past, a lot of work that has been done when it comes to integrating maybe gender even in resilience programming is that most of the time people are focusing on vulnerabilities of women, girls, and disadvantaged persons, especially during acute or protracted disasters. And these same individuals can also be powerful agents of resilience. So it's important, even when we are focusing on issues that the people in the community who are vulnerable can also be powerful agents of resilience. For example, we have extensive research reports that supports the roles of women empowerment in strengthening resilience. And some of the examples that we have is that in Kenya, research has shown us that women are critical to the adoption of climate smart agricultural practices that promote long-term community resilience to climate and ecological shocks and stresses. So there's a lot of evidence that even these vulnerable members of the community are able to contribute in strengthening resilience. So the other thing we have to understand is that gender has a way of influencing the skills, the strategies, and mechanisms that individuals use to cope with and adapt to disturbances because of the different skills and strategies and also mechanisms that individuals have to cope with and adapt to disturbances. The other thing is that gender influences sensitivity to disturbances, and even within the same household, individuals will differentially be impacted by shocks and stresses. So even in our household, you'll find boys and girls, they are being impacted in a different way. Then the other thing is that a gender integrated approach to resilience addresses gender-specific vulnerabilities to shocks and stresses and builds on gender-specific capacities. It also acknowledges that the perception, exposure, and sensitivity to disturbances are gender differentiated. So very important to realize the differentiation when it comes to gender, even when we have shocks and stresses within the communities that we are working in. Here I'd want to give examples. For example, you discover when a community is faced with drought and there's little amount of food to be eaten within families, you'll find that most of the time women will reduce the amount of food they are taking so that the children and husband can also have enough. Then in some other communities, you realize when shocks and stresses come, what is typically owned by women and girls is often most fast, is what is normally sold fast. And this is quite interesting to realize there's quite a difference even when it comes to coping strategies and how it happens within the communities. Then the other thing is that when we have these stresses and shocks within the communities, you discover that sometimes men are forced to move out and migrate to far places. And of course, during this migration, they are also during these travel distances, we are not so sure whether they are so safe, and they might be affected by issues on their travels within these dangerous routes, even as they migrate to go to look for maybe within the borders or even outside the borders because of the drought that has faced the community. And then we have seen a lot happening. When there's a lot of drought, you discover that women and girls often spend a lot of time looking for water and of course trying to secure water for the animals, maybe the small animals that have been left behind. And this of course impacts the families and households in a certain way. And of course we have seen a lot happening that even during conflict and such kind of issues, you'll discover that young men and boys are often exploited and manipulated to join into militant groups. And of course, in certain times, this is when women and girls are more likely to be exposed to abuse and especially sexual abuse. So you realize that there's a lot of differences happening in how women, boys, men are affected during shocks and disturbances within a community. Then that is why some of those, what I've just mentioned, are some of the important issues we would like to focus on when we are considering a way forward, when we want to integrate issues of gender equity and social inclusion, and also resilience. So as Francis had mentioned earlier on, I am trying to give just recommendations, and I want us to know these recommendations are coming from lessons that I've learned and have been documented by USAID and also Mercy Corps and Care International. So I'm borrowing these examples from what has been documented in the past. And I'm giving these examples, running them through the program cycle. So starting from from assessment, going to design, going to implementation, and finally to monitoring, learning, and evaluation. So when we are talking about an assessment, I know a lot of us, when we are doing our resilience programs, we will have to do the risk and resilience assessment. And so for us to integrate gender in our assessment, at the assessment level, is that we have to be able to consult a diverse pool of respondents and be able to record data disaggregated by sex, age, and other common exclusion factors, just as I mentioned. And of course, the common exclusion factors that people have come across these days is either race, ethnicity, disability status, and marital status. So it is important to look at that. Then the other best practice when we are doing an assessment is when we are collecting this information. Sometimes it might look neutral information, but it really varies based on the sex, age, and the social status of the informant from whom we are collecting information from. I would want to give an example here, because when we are collecting information, for example, we are in a household, you'll find that the man in a household might report that the death of a cow is a great shock to that household, whereas a woman in that same household doesn't think that the loss of the cow is a great shock. What to her is the great shock is the death of her chickens. Why is that the great shock? Is because she gets income from those chickens to be able to pay her children's school fees. So you realize it differs even within a household. And the other example is that when you are talking more about women, when it comes to issues of assets, you realize some of the shocks that they'll be talking about is more on issues on marriage and issues on maybe divorce and but these are not issues that men would be speaking about, because these do not really concern them when it comes to issues on access of resources, even during the times of shocks and stresses. So the importance to realize the difference that will be coming in. The other thing, moving on, we have to do an analysis of the gendered drivers of resilience. And that is what Francis mentioned. And the reason why we have to do a gender drivers analysis is because we realize that social norms and there are social norms and dynamics that underpin risk at household, community, and even at national level. So, which is very important to collect this information, and also to understand that the dynamics of gender and social inclusion within target areas, and also to make sure that we are analyzing this by the domains, the impact each as an aspect of resilience. You realize that they are impacting resilience at different points. So going to what some of the things that you look at when you are doing an analysis is the framework that Francis had shared on the domains, and the framework tries to look at, we can move on. Yeah, thank you. So looking at this and this framework that was shared earlier on is that these domains must be considered at all aspects of resilience during the assessment. These include how they impact perceptions of shocks and stresses and vulnerability, and also how the exposure and sensitivity to those shocks and stresses. This, we have to look at it using this is a framework that we use to do an analysis in different programs. But now I'm specifically looking at resilience, and we have to make sure that it is integrated within the resilience assessment. And the reason why it is important, I want to give an example. Most of the times I know in resilience programming, people believe that it is very important for women to get information on matters of on the community early warning system. And sometimes this is very important, but if you don't understand the dynamics within the communities on what happens after the woman receives the information on matters of maybe floods that are coming, you might think that for the woman to have information is the end, but that is not it, because you have to understand, in some communities, as much as the woman has received information on matters of flooding, they are not able to move. Why? They might be fearing violence if she leaves the house without the husband's permission. So you realize it is not just a straight, it's not just something you can think about straight away, but you have to interrogate and understand the social dynamics and also issues of the norms within a community. So even as you're giving the women information of a flood that is coming, then you need to know how are they going to move if the husband is not within the vicinity of that place and they are not able to move. So that is very important. I also wanted to give an example of what it means when you are designing, even after you looking when you have used the analysis of the domain, analysis on the domain. Yeah, thank you. So when you look at this, is that you realize there are programs, and I know we have some programs here presented in this meeting that are looking at making sure that household have alternative source of income so that they can be able to better absorb shocks or stresses that threaten the main income source. Most probably the main income source is from a man in this household. So when I'm looking at a domain on issues of roles and responsibilities, we realize that women sometimes are really burdened with household chores, and so they are not able to get into to the economic space where they are able to diversify sources of household income. So when we are trying to see, we want to see diversification of household income, and we want to see that it's not only the men who are able to do this. So we want to include the women in this. So what are those some of the things we'll be looking at? After doing an analysis, one of the things is that you realize that the women are overburdened. So we want to work together with the men so that they can support the women in these household chores, so that the women can have time that they can be able to engage into other household, into other income sources, income generating sources. So that is how it works. So the importance of looking at each domain, of course, we do not have a lot of time here in this meeting, but there's a way we are able to look at all these domains and to be able to understand how do they influence programs that that influence resilience programs. So that is one of the things you can look at when it comes to design. So the other thing is that when we are looking at design, one of the things we have to understand is that we should design programs that address the differential vulnerabilities and builds the resilient capacity in an equitable manner, taking into account the needs and the abilities of the diverse individuals. I know we also what Francis presented on the issues that we cannot just give resources equally to these different groups of people because they are diversely enabled, and of course they are also experiencing vulnerability differently. So one of the things is that we have to ensure that we are ensure that often excluded persons are included meaningfully in all program activities, especially those that aim to build resilience and capacities, because we know very well when shocks comes and stresses, is those who are often excluded that are highly affected. So when it also comes to designing activities, we must be able to address issues that relate to gender and power dynamics, or build inclusive resilience capacities. Very important to realize that, because resilience capacities that we know very well are really influenced by gender and social norms. So the importance of also addressing matters of power dynamics and building inclusive resilience capacities. So what are some of the strategies that we'll be looking at when we want to ensure that the often excluded people are included at the designing of our programs, especially the resilience one? One of the things is that we have to conduct inclusive and intentional beneficiary targeting. That is we identify target beneficiary groups with consideration of the intersectionality and multiple layers of exclusion. That would be another, it would have done another session for us to be able to understand that even when you are a male or a female, there are other multiple layers of exclusion depending on where you are or your experiences that can further exclude you. So importance of understanding the intersectionality of exclusion. The other thing that is very important is we must make sure that we have a budget and resources for gender equity and social inclusion specific assessment in program activities. And I've seen this in a lot of places. People really miss out on this, making sure that there's a budget for this, because that is the only point that gives us the information that we need to be able to design programs that are responding to the differential vulnerabilities of the different groups that we are working with. So those are some of the examples when it comes to ensuring of excluded members of our corporate, the perspectives of the we have to include the perspectives of the often excluded person in the program design, governance, and decision making, because that is when we are able to hear what are the aspirations, how do they view, how are they looking at the challenges and the stresses that they are experiencing, to be able to get that from them. And of course, one of the very important thing is that when we are doing this and when we are reaching out to the excluded persons in our designs, in our programs, is that the inclusive interventions that we are thinking about have to strengthen absorptive, adaptive, and transformative capacity. What does that mean? Is that the specific approaches that will benefit often excluded person with the intention of transforming the unequal power relations that perpetuate fragility and vulnerability. And I know we are all clear about issues of unequal power relations that often perpetuate issues of fragility and vulnerability, which of course are exacerbated more when it comes to times of shocks and stresses. So moving on, we want to look at issues of implementation. And here at implementation, what I'm trying to just bring to the fore to us is that there are interventions that support to reduce exposure and sensitivity to shocks and stresses and builds resilience capacity for often excluded persons. And just going back to what I had said initially, is that these are borrowed from what has been documented by USAID, Mexico, and also Care International. So these are some of the examples. One of them is to strengthen the social capital, that is bonding, bridging, and linking, often of women, men, girls, and boys, to connect with groups and networks within and across their communities. And some sample activities that we have is creating safe spaces for adolescent girls to build bonding, social capital from an early age, because we realize when it comes to when times of shocks and stresses, social capital becomes a very important place where people are able to draw from. Then the other thing is, another example is trying to establish linkages between a marginalized ethnic group and government decisions or decision makers to facilitate representation of the group's needs in policy making. Those are some of the examples. So there are other several examples that I have when it comes to implementation. We can move on. Yes, so the other examples is that we need to support all persons as agents of resilience within their households and communities. Remember, we have said sometimes when the vulnerable members of the communities, most of them, people do not seek to know that they also can contribute to be agents of resilience. And it is important to consider that they are only not being supported, but they can also contribute as agents of resilience. And some of the sample activities include, especially like maybe working with the youth, with youth group on matters of waste management, which is an initiative to reduce urban flooding. You know very well, sometimes youth are often missed out when it comes even to resilience programming, but they can also be persons of agents. So I know in resilience programming, there's a lot on issues of community disaster risk management committees. So it is important also to continually provide special early warning system training for also the women. Those are some of the examples. Then issues when it comes to improving access to and control of productive resources, where we know them land, water, and financial services for often excluded persons. So some of the examples that we could be looking at is installing local water access points and supporting an inclusive community governance and management structure. I know some of you are already doing that, but these are just examples. And also another example is trying to facilitate sustainable market linkages for women farmers. Then the other thing is trying to invest directly in the empowerment of often excluded individuals. And sample activities include establishing a forum for women to be able to plan and advocate for their rights, and also facilitating group activities. Another example is if you're working within the refugee communities, trying to working with them to build their confidence. So moving on.
Lonna, you have about 3 minutes to conclude.
Okay, so the other examples, of course, is engaging gatekeepers to be able to shift inequitable social, cultural, and facilitate social change. So that is the other example. So I think we can move on. Those are some of the examples when you are talking of implementation and implementation activities. So the other one, this is actually finalizing, is when we are talking about monitoring and learning strategies. And so one of the things is that when we are talking about monitoring is that we have to monitor specific gender equity and social inclusion indicators and regular program indicators disaggregated by sex and other relevant social factors. Very important, because this enables us to see who are those who are maybe accessing or the resources as a resilience program that we have. Who are they reaching, and what are the changes that we are seeing within the groups, the communities that we are working with. Then the other thing is that sometimes when it comes to working with excluded groups of people, sometimes as organization, maybe this might not be our area of expertise. So we are always encouraged to work with partner local organizations that really focus on these excluded groups of people. And then, of course, this had been mentioned earlier on by Francis, the importance of providing gender equity and social inclusion training for program. And of course, if you're not directly implementing, you're working with partners, of course, then the partners also have to have this information so that you can implement, you can work together. You can work together and you are looking at issues in the same way. We can move on. Yeah, so of course, now when it comes to you are collecting data, you're also reviewing, and especially to qualitative data on gender equity and social inclusion, because this is especially very important, because the qualitative data helps us to understand what are those changes that we are seeing within the communities that we are working with, especially when it comes to power relations, when it comes to issues of attitudes, when it comes to issues of norms. Very important to see the changes that are happening within the communities. And finally, there's one thing that people always don't consider, which is very important. When it comes to hiring the staff that we are hiring, it's we must consider not just the experience during the hiring, because remember, we are working with communities that are often excluded. So there's a high probability that people from those communities have not gotten the opportunities as others who have not been excluded in the past have gotten. So the importance first of targeting individuals with qualities that enable interactive learning and flexibilities, because there's a lot of learning that is happening within such programming, and of course a lot of flexibility where, you know, this, even though this is what had been planned initially, with the changes that we are seeing, there's a lot of flexibilities that is required. And the other thing is always to make sure that we are looking to give opportunities to candidates who are often excluded due to systemic inequalities. So that is very important, because when you're working with excluded communities, remember, there's been a lot of systemic inequalities and the importance of reaching out to them. So those are some of the strategies and activities that a program can consider when they want to integrate gender equity and social inclusion. So I beg to end at that, and thank you so much. And maybe over to you, Joy.
Thank you very much for that presentation, Lonna. Thank you for taking us through how we can mainstream gender in the whole program cycle, right from design all the way to even evaluation. Thank you for sharing that with us. We'll now dive into the Q&A session, and the Q&A session is going to be moderated by Pauline. Pauline is the K4R Community of Practice Coordinator. Over to you, Pauline, to run this session.
Wow, thank you so much, Francis and Lonna. Very interactive sessions and very many questions coming in. So I'll start with the first one from Beatrice to Lonna. Beatrice Nzovu asks, why are women the ones who sell off their assets first and not men as a coping mechanism during a crisis? Is this culturally influenced? How can it be addressed since it disadvantages women further? You, Lonna?
Okay, quickly just to answer, and thank you so much for the questions. One of the things I realized, remember these are anchored into cultural norms within our society. And often you just looking at, of course, for those who come from the pastoralist communities, you know very well when it comes to issues of selling cows, that cannot be easily done. So the easiest asset to be sold is the chicken and the small animals that the women own. And for me, that is why it is very important to do an analysis and also working with the gatekeepers within these communities for them to understand what losses the women would be going at when they are selling their small animals as opposed to what the men as opposed to men. So what I think is that it is very, I always say it's a complex situation, but we need to navigate and see how we work within these communities, especially not bringing unintended effects of issues of gender-based violence. So just to answer a bit, but maybe this is an ongoing conversation, we can begin to think what are those options we have within our communities to be able to pass this information across, what it means to the women. Over to you, Pauline.
Thank you, Lonna. So Otieno asks, Otieno from Tika, to you, Francis, with the emerging trends of data collection and the challenges brought about by COVID-19, there are cases where women living in the rural and informal settings are hard to contact for feedback in programming because they may not have access to internet or smartphone. How well have you filled this void? I think in relation to the program you have. I hope I wasn't too fast, Francis.
No, I got you. And I think there's another one from Summit to me.
Yes, and another one
from Bernardo.
Yes.
So Otieno, challenge of women living set the emerging data mentioned in my the need based systems. Different challenges. If success, then the program has of affecting particular community later on that in country standing and how based intervention that
oh, Francis, you're breaking. We can't hear you well.
Sorry, the internet here is really a challenge. Am I back?
Yes, you are.
Is that better? So
Much
Sami
better.
is really about contextualizing your interventions and your strategies to suiting the need of the community with which we are serving. Sami from Turkana asked a very important question on how we are going about women inclusion in community forums and meetings and key decision makings. I think Sami, you said Nawiri works in Turkana and Samburu, maybe very specific to us in Nawiri, and I want to recognize my chief of party, Darius, logged into the meeting. Thank you so much, sir. So the design of Nawiri, first, just to bring the design of Nawiri in brief, two-phased program. Our first phase is, which we are about to come to an end, was a learning phase, which is evidence generation, just trying to understand deeply, because we are a program that seeks to reduce persistent acute malnutrition, understand the interventions that have been there, what are the gaps that have existed, what are the interventions at work that need to be scaled up. Then we move into our second phase, which is implementation. So how do we ensure women inclusion when we're implementing pilots? And the main one, we are co-creating solutions with our communities. We've done a robust gender strategy. We've done a political economy assessment and many other studies to help us understand the counties of Samburu and the county of Turkana. We'll sit down again with a human or a user-centered approach to talk to our communities, to co-create with them solutions to the challenge. And our interventions will be and are context specific, meaning that challenges in one livelihood zone, agropasture, for example, might not be the same challenge in the fisheries area. And that one we are giving very keen eye on as we co-create with the solution. Again, giving it a multi-sectoral approach where we are working with varied intervention, varied line departments and ministries, while we are strengthening the system and working with community structures. So having done the analysis and putting in mind the approach we are putting, that we are using of co-creating with the communities, we are making very deliberate steps to ensure that no section of the community is left behind, that women are involved, men are involved, youth are involved, adolescent boys and girls, their voices are all captured in the implementation of our activity. So Sami, watch out for, you said Nawiri in Turkana. Finally, on Bernard Ochola's question, there's been a bit of challenges in the political sector, accepting changes or to do with inequality. How do we approach it differently to inculcate transformation? Transformation is not easy to achieve, Ochola. It is a process, it is effort. We will have to put this effort many times through a period of time. Good thing you have noticed that some departments are already changing. That is great. More changes then will happen because already we have a starting point. So we keep pushing. It's a deliberate action. Change is made to happen. We must make the change to happen. We must work with the community, lift up the voices of the disempowered and the vulnerable communities to engage leadership until we get there. Finally, we will be there. It will take us time to, and I say transformation, we are addressing the root cause institutional and structural inequalities. That will take time, but we will get there. Back to you, Pauline.
Pauline, you are muted.
I'm sorry. Thank you, Francis. So moving on to probably our last question addressed to Lonna. Alan asks, where are we in terms of integrating gender approaches or models with the resilience programming? Well, according to your assessment, probably, can we comfortably say that the civil society organizations are adapting and adopting this into their resilience programming?
Well, very, very interesting and challenging question. But before I answer that, there's something I just want to go back to. There was a question about how do we make sure women are included in decision making? And this is something I've always experienced. You know, one of the things people think is that by bringing women into the decision-making forums, that is one of the way we are ensuring that they are part of what is happening at the decision-making space. But I've realized bringing them in does not necessarily mean their voices are heard, because they could be in that forum, a decision-making forum, but they cannot be able to voice their voices because of maybe intimidation, not necessarily intimidation, but the space does not allow. So for me, that might not be necessarily a very good way of bringing women into decision-making spaces. We have to understand, because we know the women have voices and they can be able to voice out what they desire and what they want to see happening, is that we have to know how do we collect this information from these women. So that is very important, not necessarily by bringing them in that decision-making forum, but to make sure that their voices or what they are speaking about is heard in those forums. Going on to what you've just asked, a very challenging question. I think from what I'm reading a lot is that not much has been happening, especially in the space of resilience programming, because one of the things is that people have not taken time to do an analysis, an in-depth analysis, especially on how gender issues affect resilience and especially resilience programs. So I would want to say, for me, from where I sit, is that it is just beginning. Initially, I would say what people are looking at is the numbers of women and girls maybe included into a program, but you know, that does not necessarily mean we are reaching out to the excluded members of the community. So I think much more needs to be done, but starting from understanding the gender and social inclusion issues that are affecting the communities that we are working. So let's say to a percentage, I don't know, Pauline, you'll correct me because you're the ones working with the resilience programs here in Kenya. I think maybe we are at 50.
Yes, around there. We may not be able to quantify.
Yeah. Okay.
Thank you so much, Lonna. One quick one from someone who really needs an answer, but I'm seeing we are running out of time, so probably just in a second. Also, how do we ensure that we close the gaps in access to UHC, that is universal health coverage, in terms of including people who it's very